The year 2023 is coming to an end, but on the contrary, it may be the beginning of something new, something very concerning. A subvariant of COVID-19, it's called the JN.1. COVID subvariant JN.1 has been identified in a woman in Kerala, which has raised concerns and has emphasized the need for an alert. The JN.1 variant of COVID-19 was the first detected in India in October 2023. As of December 2023, it has been found in several states, including Maharashtra, Delhi and Kerala. What do we know or need to know about this subvariant? Also, how dangerous is the subvariant? Should India be worried? And is it alarming? And most importantly, are we prepared? Let's find out. One is a mutated subvariant of COVID-19, a descendant of the BA.2.86 variant, also known as the Pirola. In simple words, JN.1 is a new virus in the COVID-19 family. It was first detected in the United States in September 2023 and has since been found in several other countries, including China, of course, and unfortunately India as well. Here are some of the takeaways of the JN.1 subvariant. According to the Indian SARS-CoV-2 Genomic Consortium, also abbreviated as INSACOG. In case you haven't heard of INSACOG, it is a joint initiation by the Union Health Ministry of Health and Department of Biotechnology with Council for Scientific and Industrial Research and Indian Council of Medical Research. It is a consortium of 54 labs to monitor the genomics variations in the SARS-CoV-2, which means that these 54 labs across India work together to track these disguises of the virus. They use high-tech machines called sequencers that can read the virus genetic code like a secret message. By reading this code, they can see what kind of disguise the virus is wearing and predict what it might do next. So in simple terms, INSACOG is like a virus monitoring network that helps keep India safe by uncovering the disguises of the sneaky COVID-19 virus. Now coming back to JN.1, it is currently the dominant subvariant in India, accounting for over 90% of all sequenced cases. JN.1 is a mutated variant of the BA.2.86 or Pirola. Pirola has a total of 20 mutations on the spike protein, which was a big concern when it was first found, because the spike protein is what the virus uses to latch onto the cells of the host. JN.1 is said to have a single change from BA.2.86. Now imagine the virus like a spiky ball. BA.2.86, aka Pirola, is like a ball covered in 20 extra spikes. These spikes made it super good at grabbing onto an infecting cell, which is quite alarming. But in the case of JN.1, it is like a ball with just one extra spike. It's still spiky and can infect people, but not as easily as BA.2.86. Now let's talk about the severity of JN.1 and its impact on India so far. It was first detected in the United States in September. As per Reuters report, on 15th December, China detected 7 infections of the particular subvariant. According to Mint reports, JN.1 have been spreading in countries like the United States, the United Kingdom, Iceland, Spain, Portugal and the Netherlands. So far, it has been detected in 38 countries, including India, and is believed to be responsible for the recent hike in hospitalization in some few nations. In India, the most recent case detected is in Kerala in a RT-PCR positive sample from Karakulam in Thiruvananthapuram district of the southern state on December 8. The patient was a 79-year-old woman who had mild symptoms of influenza-like illness and has since recovered from COVID. As per the latest updates with JN.1 witnessed in Kerala, neighbouring Karnataka has started taking precautionary measures to tackle the fresh outbreak. The state's health department has begun preparations to handle any spike in COVID cases. Karnataka Health Minister Dinesh Gundu Rao stated that the situation is under control and urged people not to panic. There is nothing to worry about as of now, he stated. As per our records, we have about 58 active cases. 11 are hospitalized and the remaining are at home. So far in the last 3 months, we have had one death due to COVID-19. But the person who died had other comorbidities also, he stated. Take a look.
Because number of cases have increased there, and Karnataka as of now today and in the entire state, as per our records, we have about 58 active cases, and in that 11 are in hospitalized and remaining are at home. And so far in the last 3 months we have had one death due to COVID, but also they had other comorbidities. So the person who died had a lot of other issues, but also he had COVID. So that is one thing. But otherwise, we have already, taking precautionary measures. We have told to increase testing in all the hospitals and health centers. Who was coming with symptoms of cough and flu and other COVID-like symptoms, respiratory infections, whatever that is there. For all of them to start testing for COVID, so RT-PCR kits, we need to get more. So we have already started the purchase for getting more RT-PCR kits and rapid antigen tests, all those kits that are necessary. We have some in stock, but we'll be requiring more. So we'll amp up testing. Then through that we will come to know whether the infections are there or on the rise or not. Post that, then we can take a decision what to do.
What about the border areas, sir? Because
No.
connective areas which are connected.
No, right now I don't think we should panic and start, checking at the border areas or stopping movement. That is not required. But we will keep an extra vigil on those border area hospitals and nursing, our hospital health centers, to do more testing there in particular, so that we can pick up any early rise in cases. And also we have done a mock drill in all our hospitals and health centers on the availability of ICU beds, reserved some for in case if there's a breakdown of COVID, then we need to have enough ICU beds, enough oxygen, enough all the other drugs that are required, consumables. All those things we have told them to keep in stock and keep everything available. So there should not be any lack of ventilators or oxygen or anything.
What your technical team is saying, sir, we expert in.
Spoken to the chairman of the technical advisory committee. So earlier we had thought that we'll fix the meeting for because they are out of station, but they'll be doing it today itself online. They'll be sitting and discussing all those things, and tomorrow whatever the technical advisory committee recommends, that direction also will be issuing it. Maybe by tomorrow we should issue the directions, or maybe today itself.
The reported symptoms of JN.1 include fever, runny nose, sore throat, headache, and in some cases, mild gastrointestinal symptoms. Apart from this, the doctors also emphasized that most patients experience these mild upper respiratory systems, which typically improve within 4 to 5 days. And as per the precautionary measures, Dr. Prakash has advised that individuals with viral infection symptoms should promptly cover themselves, wear masks to minimize the risk of spreading the infection, and undergo testing early. If symptoms persist, individuals are encouraged to isolate themselves from the general public, the doctor added. The Karnataka government has decided to conduct mock drills in the hospitals to check preparedness in the event and the pandemic recurs in the state. The government has also convened a technical advisory committee on COVID-19 on Tuesday. On Saturday, India recorded a single-day rise of 339 new COVID-19 infections. The number of cases reported was higher than the 312 cases reported on Friday. As per the Health Ministry, the active caseload rose to 1,492. The country's COVID case tally currently stands at 4.50 crore 4,481. So far, it's safe to say that the situation is under control, but as we all know, precaution is better than cure. So stay safe and follow the precautionary measures, and let's hope that we don't face another pandemic.